I call the member for Bowman.
Well, today will be marked in the history of public health in Australia as another one of the days under a Labor administration that broke the hearts of people waiting for preventative and public health outcomes. We have obviously a Labor administration utterly focused on inputs, and that means that when they have the hard and adaptive work to be done in one of the great challenges of health around the world, and that's preventative and public health, they resort to type. They turn to a new bureaucracy, a new statutory authority in their third and soon to be their fourth year of their administration. Now, of course, it was incumbent upon a new Labor administration in 2007 to pick up on the great work that had already been done and build upon it. And this debate would be incomplete without a recognition, Deputy Speaker, of the history of the impressive work done by Australia in the areas of preventative health. And I give this history in no way to discredit the work of those who come before us, because obviously in something like preventative health, the work of successive administrations have always improved and built upon those that came before them. We can remember as early as the 1990s the National Agenda for Early Childhood, which was implemented obviously under the Howard regime, but I could even go back earlier under the Keating administration to the National Nutrition Strategy in 1995. So from there we already recognised as a nation the importance of nutrition and the importance of physical activity in combating obesity and of course the unhappy triad of hypoglycemia, high blood pressure in that process. Now we moved on, and I could go through the child obesity summits that occurred in 2002, led by a number of people, but Senator Guy Barnett playing a significant role in organising that refocusing on obesity rather than just communicating about nutrition and physical activity, which had never gained traction as much as we would hope. Then, of course, there was the focus on weight loss in 2008, the National Public Health Partnerships, and a real shift through the 2000s towards a focus on new qualifications for those in the health workforce who would deliver those preventative measures, acknowledging and recognising that it wasn't always frontline service delivery individuals who performed those roles, that we had to move outside of hospitals, and even an acknowledgement that the greatest health outcomes can often be achieved outside of the health system itself. That was a very important refocusing, Deputy Speaker, and an acknowledgement that we need to look not only at the minorities, at immigrants, at Aboriginal and Torres Strait Islanders, those of low socio-economic means, but also recognise that health sits upon a foundation that revolves around having tenure in one's home, having levels of education, having children going to school, and obviously those elements are just as important as an explicit focus on healthcare and health checks. Now, let me be honest, public health has for a long time been not only a very small part of annual health expenditure in this and other developed economies, but it's been very fragmented. And with 8 jurisdictions, as I've said before, we have the opportunity both to learn from the work and the excellence in certain jurisdictions, but also we have the opportunity or the challenge to reach across and make sure that those efforts are coordinated. And just as one state heads down towards tuck-shop campaigns and another state heads off towards teleconferencing or phone facilities, we need to make sure that there is a level of consistency around the nation, and that is why the Commonwealth will always have an indisputable role. Acknowledging what this administration has done in an attempt to have a single funder arrangement for preventative care would have very little opposition either from this side of the House or from the general community. What I think is a bigger challenge is to acknowledge that there's a certain rite of passage, Deputy Speaker, in an area as tough as preventative health, as an area that requires the adaptive work to be done, bringing people together from seemingly unconnected professions to achieve an outcome. There's a certain rite of passage, and I'll tell our Health Minister what it is. Some of that adaptive work gets done, you get some results on the ground, Deputy Speaker, and then the Health Minister, I think, then has the right to introduce this slew of statutory authorities and bureaucracies. My problem is where that's all that's occurring. And apart from a slight refiddling of the Commonwealth state funding arrangement and a construction of regional health boards that are fundamentally a fourth level of health bureaucracy, there's very little happening on the ground to lead to better public health outcomes. Now, those on the other side of the chamber will ask, well, why can't we simply herald the arrival of a new preventative health authority? And the answer is this, that in 2, 3 and 5 years' time, when people read the contributions made in this debate, let it be very, very clear that this opposition said it's fine to have the bureaucracy. We want it as small and streamlined as possible, but you can't have it without any action on the ground. What we want to see on this side of the House is not just this solitary focus on statutory bodies and authorities. Not everything can be done from big government. It's challenging enough to deliver services that are coordinated from Canberra. But I just beg this government, when $130 million floats past the Prime Minister and down to the Health Minister's office, I beg this government, I beg the Health Minister, don't just fall for the trap of yet another series of television ad campaigns about why you should be switching off the television. I beg the Health Minister, when you think about $13 million, 13% and $17.6 million to administer this behemoth, ask the very question, is that just a 13% administrative fee sliced up the top of what should really be preventative health outcomes on the ground? Or possibly, is this actually too small to effectively be able to bring together the disparate public health communities in this country and come up with the answers that we really need? Is this absolute microscopic contribution towards research, Deputy Speaker, adequate to even fund a single multi-centred study to give us the evidence that we need? The answer is absolutely no. The amount of tokenistic millions here for research is so tiny that it is almost an embarrassment to include in this bill. And I would argue that money needs to be where it belongs, being contested openly through the NH and MRC. Now, the other great uncertainty from the rest of Australia about where exactly this government is heading, as we see boxcard before us, legislation after legislation pertaining to new bureaucracies, is exactly what is the relationship between this new authority and the Health Minister? Well, the answer is quite simple. There's 9 members plus chair, and they're all appointed by the Minister. So can you imagine the lifespan of a member of that authority if they have to recommend something that is against the government's objectives? I would have thought the best way to empower the experts in this field is not to select 9, however distinguished individuals they are, fawning sycophants who only tell the Minister what she wants to hear. I mean, the last thing that members on this authority are going to want to do is to be recommending something that government doesn't support. Of those 9 plus 1, there are only 2 positions for state representatives. Now, given that historically the great effort in preventative health has been performed by state administrations, they have a wealth of experience, enormous amount of state funding supports that research work, I would argue that there is a formula here for great frustration among states that aren't represented. And it would have been far wiser, I believe, to have all states involved early on until there is a significant clarification of the direction of this body. Next, of course, is the concern about how this body will function here in Canberra. Are we simply going to be populating the authority with public servants out of the Department of Health and Ageing? Will we have the capacities, and can we afford them in this administration as has been set up? There are significant questions around that. The agency itself could well have been an advisory committee bringing the smartest minds together, lean and mean and focused. But what we have here presented before us is vague, with an overwhelming focus on television public health advertisement. And the great concern is that this administrative body in the end simply monitors and transacts contracts regarding to TV ad campaigns. Will we be any further advanced? Will the tiny child living in a remote community even feel the slightest change in public health service delivery as a result of this body if the overwhelming proportion, nearly 75% of this entire funding attached to this legislation, are TV ad campaigns, probably telling people to switch the TV off and be more physically active? There is an ideological division here because fundamentally we have a government that believes that the bigger the bureaucracy gets, the better people will live their lives. And fundamentally, the flaw in that is that we are missing the incentives to bring professional groups together and come up with the innovative approaches that were delivered quite effectively and efficiently by the Howard administration. The lifestyle prescriptions that were GP focused, that allowed people who had recurrent contact with a GP 6.8 times per year to talk about lifestyle issues. It was highly targeted. It was one-to-one with a highly qualified practitioner. We needed a multidisciplinary approach so that health prevention didn't float off on its own. And of course, we needed to work on systems that brought together the best people in communities to come up with interventions. My great concern is that this is a cost recovery administration. So every time a state administration asks for some advice from this authority, Deputy Speaker, they'll be given a bill, given a chit to pay. I mean, this again heralds this new Labor approach that the more something works, the more you tax it. I implore this government that the better it works, let it rip, let it go, let it use its own creativity and achieve great things. But instead we've seen consecutively, Deputy Speaker, taxing the things that are good, okay, and then we see good money going after bad. And that is what needs to be avoided. What we need here is to talk about a whole range of issues around health promotion, awareness, and of course the regulatory changes that may well be needed. But what chance does a committee fully appointed by the Minister have in recommending some regulatory change that may not be popular with the government? There is inadequate separation, and this group needs to be more separated from the Health Minister. We need them to be truly independent, not have money already set aside for nothing more than public awareness campaigns. What we have seen moving in to the fourth year of this administration is almost no progress. Now, what we will hear from the government will be a chorus of, you rip money out of the health system. Now, in no year ever did funding to health decrease, and there was no more money ripped out of the health system under the Howard government than there was money ripped out of the school system by the Rudd-Gillard government because they built a hall last year and they didn't build a hall this year. The pure reality is that the increases in health funding were slightly lower in the subsequent agreement, but it never ever came close to going down. There was no ripping of money out of anything, simply a growth that wasn't as large. And hey, for a whole host of reasons, including paying off debt over a decade, there were considerable challenges on the health system which I'm proud to say the Howard government did not pass on to the current administration. Look, we are touching now on an opportunity to address health inequalities. We genuinely have the option to take great information and advice from overseas and to apply it in preventative health. But let's be honest, when it comes to preventative health, Deputy Speaker, this is an intensely personal choice about the degree to which we exercise, how much time is spent in a sedentary lifestyle, how many hours we spend at work, and they are some of the great challenges to move this Titanic that is preventative health even just a millimetre. So I don't put unreasonable expectations on this government. I don't ask them to prove within 12 months they can gain improvements, because that may well be way too ambitious. But I say there is a rite of passage in this game. There are generations of great work as we go back well into the history of Australian healthcare delivery, that slow and careful gains have been achieved. It is inadequate to simply set up an authority over the top and promise miracles. This will be hard work, but we cannot afford to have an authority that is top-heavy, full of fawning sycophants, and I mean that with no offence, but we need some separation from the minister, okay? And then finally, we need to give them the freedom to be able to reach out and fund the work that needs to be done. Part of that's reaching out and using overseas information. Australia doesn't have to reinvent the preventive health world, it simply needs to pull together best practice. Most of this is already well known. Most of this information is available from any school of public health around this nation that has provided some of the world's greatest practitioners. What we know is that there must be a focus on high-risk populations to start with. There needs to be a focus on making it a natural part of people's lives delivered through existing structures. And yes, I concede there needs to be some cross-corroboration, some translational research that takes great ideas from one area and can apply them more broadly. That's fine. But you don't need an authority to do that. What you need is a lean and mean advisory committee, as I've argued already. They've existed before and worked perfectly well. So I encourage this government, not because I don't concede that one authority is probably okay, but what we're seeing is a health administration that has lurched from from taxing alcohol pops and driving young people to full 750ml bottles of spirits. We've seen a focus on slicing cataract rebates in half. We've seen a focus on ripping out private health care, and in the end, public and preventative health will be the victim.